Hi everyone, Dr. Chung here. Today I'm going to go over the usual topics that I go over during the 6-month well child check. First of all, as far as nutrition goes, the number of times that typically a 6-month-old needs to be offered the breast or the bottle is approximately 3 to 5 times per day. And if they're bottle fed, the rough estimate of how much they might take at a time is approximately 6 to 8 ounces at a time. At 6 months old, moving forward, usually the total daily milk intake tends to plateau, and we want solid foods to gradually become a greater proportion of their growth in calories over the next few months. So I say if a family hasn't started solid pureed foods yet, or if they're doing it once per day, then I encourage them to increase the solids to twice per day by approximately 6.5 to 7 months old. Always continue to offer the pureed solids before offering the breast or bottle. If a child at any point is eating the solids very well and therefore it decreases their appetite or hunger for milk, then that's okay and that's normal because the solids are very calorically dense and have tons of good nutrients and vitamins and iron and calories. We don't want a child to be full on milk or formula right before you offer them solids and therefore be less hungry for solids. So always offer the solids before milk rather than right after. And I usually send parents a sample menu from healthychildren.org, which I can put a link to below in the description. A sample menu for an 8 to 12-month old, which if they take a look at that, it gives them a guide to how to slowly increase the solid foods over the next few months. So if you look at that sample menu, what you'll notice is at that age, 8 to 12 months old, eventually you want to do at least 3 meals per day. And then later, if your child is doing well with that, add 1 or 2 snacks. And you'll notice that even one meal of solids can look like a lot, 2 to 8 ounces at one time. And this is not to pressure you to increase the solids rapidly, but how to slowly increase over subsequent months. The age at which a child's swallow coordination improves, and therefore it's safe to give some small, soft finger foods is 8 months old and up. So I tell parents for the most part to keep it soft and pureed for safety swallowing reasons until 8 months old. And then at 8 months old, soft finger foods that would be allowable from a swallowing perspective would be things like scrambled eggs, soft pastas, soft breads, cheeses, or well-cooked meats diced up into very small pieces would be allowable. You still want to avoid things that are too chunky that might be a choking hazard, such as things like raw apple or carrot chunks, grapes that aren't cut up into super small pieces, things like popcorn because of the firm popcorn kernels, hot dog pieces because they're so firm and rubbery. So you still want to avoid things like that because a child is not expected to be able to chew well at 8 months old. A child isn't necessarily going to be able to get a lot of nutrition from baby-led weaning strategies at 6 months old, but you're allowed to, for development progression reasons, if you want to do some baby-led weaning strategies, like have your child gnaw on something soft like an avocado spear or a chunk of banana. Anything like that is okay for a child to gnaw on that for, again, to practice that coordination, as long as there isn't a risk of some piece breaking off and getting caught in the child's throat. But the majority of the nutrition at this age is going to come from continued breast milk or formula and pureed solid foods. As far as allergens go, it's important to have your child try some form of peanut, such as thinned out peanut butter, before approximately 6.5 months old. If you delay first time peanut introduction past then that increases the chance that your child will develop a peanut allergy. So I tell parents you should expose your child to something with peanut, like thinned out peanut butter, prior to 6.5 months old. And you Just pick any brand of smooth peanut butter, thin it out with something like water, breast milk, or formula. Since it's so thick, you just give it to your child with a spoon. And we say to give approximately 2 teaspoons at least 3 times a week for a few weeks, which is considered to expose your child's body enough to decrease the chance of developing a peanut allergy. The other allergens aren't as time sensitive. We recommend exposing your child to some form of egg before 9 months old, and it's recommended to expose your child to other allergens before approximately a year old. So the other allergens to expose at some point, and that you do not have to delay these things, would be things like almond butter or any form of different nuts, anything with sesame in it, dairy things like yogurt, and any form of fish or shellfish. So at the 4-month-old checkup, I make sure to tell parents that if your child is breastfed, so they're not getting iron from the formula, then replace the once a day vitamin D supplement with a multivitamin with iron, which has the vitamin D plus the daily iron requirements in it. And we want to continue that at least until 6 months old. And you can stop the iron supplement and switch back to vitamin D whenever your child is eating some iron containing foods, such as spinach or sweet potato or beef, chicken, pork, or any form of soybean like tofu, hummus, beans, things like that. But even if your child is eating those things and your child is taking the multivitamin with iron well, then your child cannot overdose on that amount of iron. So even if your child is eating iron containing foods, if you as a precaution want to continue the multivitamin with iron, then it's very fine and safe to do that. The developmental milestones, which we look for in a 6-month-old, are being able to flip over from front to back. If you sit your child up, them trying to tripod and being able to balance for a couple seconds, reaching for things, wanting to put everything in their mouth. And some of the other social language milestones are doing more babbling and laughing actively and turning their head towards someone's voice. The standard vaccines at 6 months old are the third round of the same vaccines that your child got at 2 and 4 months old. So they would be the third round of the oral rotavirus vaccine, the third round of the pneumococcus shot that prevents meningitis and pneumonias, and the third round of, at our site, the combination vaccine Vaxelis, which is a combination of DTaP, polio, Haemophilus influenza type B, which also prevents meningitis, pneumonia, and bloodstream infections, and the final round of hepatitis B. If it's leading up to or before flu season, then at 6 months old, your child is eligible for the flu vaccine, which is safe to give with these other vaccines. The side effect profile of the flu vaccine is similar to these other vaccines, meaning it can cause a little bit of fatigue, some soreness at the thighs, and fussiness, and possible fever for up to the next 48 hours. The first year a child gets the flu vaccine, they need 2 rounds of the flu vaccine to become more fully immune to severe disease. So they could potentially get the flu vaccine at that 6-month-old checkup with the other vaccines. And then we would recommend scheduling a nurse visit for about a month later. So anytime after at least 4 weeks has passed for the second round of the flu vaccine. At this age, when your child turns 6 months old, they're also eligible to receive the first round of the COVID vaccine. At our site, we carry the Pfizer COVID vaccine, and it's a 3-shot series for this age of children. One of the reasons why it's a 3-shot series instead of a 2-shot series when an adult first receives the COVID vaccine is because they made it 1/10 of the adult dose to minimize side effects for young infants. So you can get the first round at the same time as the other 6-month-old vaccines. Again, it's very safe to give with the other 6-month-old vaccines. And the second round would be anywhere from 3 to 8 weeks after the first round. And I recommend getting it about a month later, which would coincide with the timing of the second flu vaccine. And then the third round is anytime at least 8 weeks after the second round, which if you follow this schedule, then it would coincide with the 9-month-old next well child check. The Pfizer COVID vaccine, because of reasons I mentioned, has the least side effect of any of these vaccines that I've mentioned, with the main side effect being soreness at the site and very minimal chance of other side effects like fever. Those are the usual topics I like to go over at the 6-month-old wild child check. And next time we'll go over the usual topics for discussion for the 9-month-old wild child check. Thanks, everyone.